I think it's our job to inspire. It's our job to be the tip of the spear. It's our job maybe to build the first couple of boats because we yearn to cross the sea and say, look, it can be done. But then it's not our job, not exclusively our job, to get everybody across that sea. It's too big a job, right? That's where I come back to where we started. Culture is the spoons. Culture, using your quote from Saint-Exupéry, culture is the armada of ships that can get everybody to the far horizon.
Welcome to Back to the Future podcast. My name is Victor Sadia, and I talk with brilliant minds and hearts of people who want to uproot and transform the current health and wellness paradigm. Good morning, good afternoon, good evening. Today we have Dr. David Katz. Dr. David Katz is an internist with a master's degree in public health and a fellowship in lifestyle medicine. He founded the Yale-Griffin Prevention Research Center. He was president of the American College of Lifestyle Medicine and is the founder of the nonprofit True Health Initiative. He's the author of hundreds of scientific publications, as well as several books, and has been recognized as the Poet Laureate of Health Promotion. Dr. Katz, thank you for joining us.
Great to be with you, Victor. Thank you.
So, you've talked about lifestyle medicine being the right medicine for a lot of things in the world, not only individual health, but also cultural and planetary health. And at the same time, you talk about culture being the spoon on how to deliver lifestyle medicine. Let's go deeper into that metaphor.
Well, the reference to the spoon making the medicine go down comes from Mary Poppins. So, you and I, before we started recording, we're talking about the importance of stories and narratives. So Mary Poppins is a good story. And it's a good song. Spoonful of sugar helps the medicine go down. So, the idea is that there's always some resistance to medicine. There's always some friction. The idea in Mary Poppins, of course, was that it was literal medicine that tasted bad. And so if you added sugar, it sweetened the medicine, helped it go down. So as I think about all that lifestyle medicine could do, and of course, this is common ground for the two of us, we both celebrate that potential. We know that if lifestyle were routinely the medicine it ought to be, that 80% of all chronic disease in the modern world would go away. 80% less diabetes, heart disease, cancer, stroke, dementia. There'd be 80% less premature death. It's just incredible. So then the question becomes, okay, if the value proposition is that great, if the promise of lifestyle as medicine is that great, why won't the medicine go down? Same kind of idea. There must be something distasteful about it. Maybe it's just that people don't appreciate its value. Maybe it's that people don't know where to find it. Maybe there's something about it that they actually don't like. I like eating hamburgers and French fries, and I don't want to eat in a way that's better for me because I have to give up the things that taste good. I love drinking Coca-Cola. I don't want to give that up. So, what will help that medicine go down? So I sort of was playing with the song in Mary Poppins and thinking that, lifestyle is the medicine. But in order for it to go down, we need to change our cultural narrative. We need people to understand that health should be revered. Health is a family value. We should, as we're raising our children, we ought to have a perception of health more like our perception of wealth, something people aspire to, a mark of achievement. If you're healthy, wow, you're accomplished because you made yourself healthy, you made other people healthy, you made your family healthy. That's a real distinction. Wow, you should be very proud. We don't say those things, but we should say those things. So it has to reverberate through our culture. And then we need to think about making it easy for people and the medicine they need to come together. So every place people and food come together, it should be high quality food that nourishes health. And people and their daily routines should create opportunities for physical activity. So you don't have to work quite so hard to fit any physical work into your daily routine. It ought to happen naturally. And in those places around the world where lifestyle really does get the job done as medicine, it isn't because people are working really, really hard as individuals. And it isn't because doctors are providing especially good counseling. It's because culture makes healthy choices the default choices. And the places I'm talking about, obviously, are the blue zones. There are others, but the 5 blue zones characterized by Dan Buettner and others, where people routinely live to be 100 and don't get chronic disease. They don't say we have better willpower than everybody else, and they don't say we have better doctors than everybody else. They just have a better culture than everybody else. So, even if we just look at the empirical evidence, where do you actually see this medicine going down? Where do you see a whole population benefiting from lifestyle nurturing health at its origins? It's where culture makes it so.
You've also said that, feet, forks, and knives are really at the core of change. And in this sense, I think that when we're talking about culture, we're also talking about words. How successful has been lifestyle medicine in the past, let's say, 20 years in infiltrating the culture? Obviously, in the medical arena, that's fairly obvious, in the health professional arena. But how about the political, the social, the media, and all that?
Well, first of all, a slight correction, if I may, Victor. It's feet, forks, and fingers.
Sorry.
And no, that's all right. And just to clarify what the reference was to, so I finished my training in internal medicine in 1991, and then finished my training in preventive medicine, public health in 1993. In 1993, within weeks or at most a couple of months of my graduation, a paper was published in the Journal of the American Medical Association entitled Actual Causes of Death in the United States. And it might just as well have been actual causes of death in the modern world because our epidemiology is much the same. But what that paper was about, and it was by two preeminent epidemiologists, Bill Foege and Mike McGinnis, it was about looking past the explanations for death on a death certificate. So, somebody dies of heart disease, the death certificate may say myocardial infarction or congestive heart failure. Basically it will imply that they died of heart disease because they had heart disease. It doesn't really tell you, yeah, but what caused the heart disease? So McGinnis and Foege asked the question, what caused the heart disease? Where in all of this is there something that we actually could fix? And when they concluded that analysis of the underlying causes of death, so the stuff that causes heart disease, the stuff that causes diabetes, the stuff that causes lung disease and cancer, they had enumerated a list of 10 factors, just 10. And the 10 factors explained almost all of the premature deaths that happen in the United States every year. And again, this is true in Mexico and it's true around much of the world. But what really jumped out at me is the first three things on the list of 10 explained 80%. 80% of the premature deaths. And you'll hear me use that figure a lot because it's now very well substantiated in a large body of peer-reviewed literature. But one of the first compelling reports to make that case was this paper in 1993, Actual Causes of Death. So the top three factors were tobacco, poor diet, lack of physical activity. So I said, gee, that's bad use of feet, not enough physical activity, bad use of forks, bad dietary patterns, and bad use of fingers, bringing cigarettes to your mouth. So feet, forks, and fingers. And what I started to say at the time is that the master levers of medical destiny are not the tools of the medical trade. It's not some new technology. It's not functional MRI. It's what we do every day with our feet, forks, and fingers. And if we did the right things, Archimedes said, give me a lever long enough, I can move the whole world. Well, if we did the right things with feet, forks, and fingers routinely, we could move the whole world of modern epidemiology and public health to a better place. But you just asked me the question, how are we doing? And the simple answer is badly. We're doing very well in the House of Medicine because I think it's quite captivating for health professionals who are frustrated with the current model, who appreciate the power of science, but also recognize, we never make someone vital in conventional medicine. We're essentially something's always on fire, and we're putting a bucket of water on it. But the analogy I use there, Victor, is Humpty Dumpty. So another story, a nursery rhyme. All the king's horses and all the king's men couldn't put Humpty Dumpty together again. And what, as a preventive medicine specialist, you think, okay, so we need to prevent him from falling off the wall in the first place. There ought to be a seatbelt at the top of the wall. That's how a prevention person thinks. So, lifestyle medicine is that opportunity to say, let's keep people well in the first place. I think a lot of people in medicine, especially young people coming into it, are frustrated by that notion that we are all the king's horses and all the king's men. We're never going to put health back together again, just more drugs, more surgery for an ever sicker population. Lifestyle medicine is the alternative vision. Lifestyle medicine also is an alternative vision related to the planet. It's interesting. I think my younger colleagues in particular, but my peers, when I meet large groups of fellow health professionals at conferences, and I tell them, you cannot be a health professional. You cannot call yourself a health professional in 2021 if you don't advocate frequently and fiercely for the health of the planet. And they say, thank you. Thank you for giving me permission. Thank you for authorizing me to talk about something I care so much about that keeps me up at night, I didn't know it was in my purview. I think people who are compelled by lifestyle medicine do think it's in their purview, the confluence of human and planetary health. So I think in terms of influencing the profession, we're having a huge impact. But I don't think that's the right way to answer your question. I think the right way to answer your question is, are we making lifestyle as medicine reverberate through the population? Are we reducing the burden of chronic disease? Are we eliminating the threat of premature death from the usual causes? And the answer is no. And it's not because of a problem with us. We have all the right motivations. We have a lot of the right tools. The problem is culture. Years ago, I did a column and I used a cartoon as the image for this column and I think the title was Fixing Obesity We Have Never Tried. I actually had a graphic artist make up this cartoon for me. So it was a few good guys, wearing the white hats in this little boat. And the good guys wearing the white hats had pipettes and were trying to drain the boat, which was sinking. But the reason the boat was sinking is because the bad guys had a giant fire hose from the Coca-Cola fire hose company and were flooding the boat. So my cartoon had all these characters from pop culture food, Coca-Cola and Lucky Charms cereal and McDonald's, they were the ones sinking. It's not a problem with any of what we're doing. The critical issue here is a differential in size. Essentially, corporate America has the money. And hundreds of billions of dollars are spent talking people into bad habits. We don't have hundreds of billions of dollars. We have nothing remotely like hundreds of billions. How much money is spent around the world promoting lifestyle medicine every year? $1 million? $10 million? It is a drop in the proverbial bucket. So lifestyle as medicine is a movement whose time has come, and it's very compelling for the profession. But I think the critical issue for the profession now is to decide, how do we make this make a difference? Gertrude Stein famously said, a difference to be a difference must make a difference. How do we make lifestyle medicine make the difference it should? We're not there yet.
Thank you. So, reading, Michael Moss and Michael Pollan and following this, the blue zones culture, we know that we can't shame someone or populations into changing. We can't just drive through the fatalistic view that if we continue in this path, we will be dead in a few years. Statistics end up being nameless and boring. Political speeches generate resistance. In a sense, stories touch a deeper place in the soul. Like, we need stories in which the resolution is not only that the good guys beat the bad guys. My idea is we need to go back to the lived experience of eating, of moving, of sharing with others, of sleeping, and really understanding that those are the levers to move our existence. And I'm not only saying that in terms of survival, but in terms of meaning, in terms of spirituality, in terms of what the hell we're doing
Vitality,
here.
right? Overall vitality. Victor, you're a very interesting guy. You are a deep thinker. It's a pleasure to have a conversation with you. I agree with you. We have to imbue this with meaning. And one of the things that I wrestle with is that we are often talking about impact at scale, and people can't perceive impact at scale. The great liability of work in public health is that you're operating under this grand fiction because there really is no public. It's not you and your family. It's not me and my family. It's nobody in there. It's all of us, and so it's none of us. The public is nameless. The public is faceless. The public is impossible to love. And as you say, essentially everything is hidden behind a veil of statistical anonymity. Now, epidemiology is important anyway, because that's how you understand what's happening at scale. You have to use numbers and statistics, but we have to conjoin that to stories. People need to understand what lifestyle as medicine would feel like. So for many years, Victor, I would give talks, and I would cite McGinnis and Fagey and other literature and say 80% less chronic disease, 80% less premature death. This is what it could do. And then I would ask my audience, back in the pre-COVID days when there actually was an audience in the room with you, have I brought a tear to anybody's eye now talking about 80% less chronic disease? Anybody at all? Anybody crying? And of course, nobody would be crying. So, well, there's something wrong here then, because let's do this now. If somebody you love has been touched by heart disease, please raise your hand and keep it in the air. So not someone you know, someone you love. If someone you love has been touched by stroke, raise your hand, keep it in the air. Cancer, dementia. Basically just pick the short list of major chronic diseases. And I go through four. So I do heart disease, cancer, stroke, diabetes. If I add dementia, every adult in every audience I've ever spoken to had their hand in the air. And some of them had both up because, cancer, heart disease, dementia. But okay, look around the room. This means that these 3, 4, 5 conditions have invaded every one of our homes, every one of our families. Because I didn't ask you about people you know, I asked you just about people you love, okay? All right, now think about the day you got that terrible news. Think about the phone call, think about the email, think about somebody you love is in the hospital, in the ambulance, in the ICU, in the CCU. Think about visiting them in the hospital. Think about worrying about them. Think about whether or not they came home, because sometimes they do and sometimes they don't. And now picture a world where 8 out of 10 of us in this room never raised our hand because that bad stuff never happened. That's what 80% less chronic disease would feel like. So we need more of that. We need to put a face on the faceless public. We need people to understand the public is us. It's our families, it's the people we love, that 80% less premature death and chronic disease would feel incredible. Bequeathing that, the promise of that to our children, would be a stunning sea change in the quality of life. All these terrible days that we've all lived through, hearing about bad things happening to people we love, 8 times in 10, it wouldn't happen. It's incredible. So, there's a lot of work to be done to reconcile statistics and the view from altitude with the intimacy of the stories you're talking about.
And at the same time, those experiences of feeling, because we've lost in that sense, those nameless statistics have prohibited us to really feel, because at the same time it's also a defense mechanism. It also creates anxiety. And in a sense, I think that the biggest promise is getting or grabbing our attention because things are really gloom. But at the same time, the big thing with lifestyle medicine is not only imagine yourself of not having that audience, everyone lifting their hands, but instead everyone in the audience just dancing, and the promise of living life at the fullest, in the sense that you can connect with the planets, with the elements, with each other. We can connect with, the meaning that we create goes much beyond being just longevity and.
Yeah, no. So, again, you're talking about purpose and connection, and I totally agree with you. But let's just talk about the dance for a minute, right? So instead of everybody raising their hand because they lost loved ones to these diseases that don't need to happen, if everybody got out of their chair and danced because everybody had that vitality, that reminds me of another story. My father's a cardiologist. He'll be 82 next month, and still we hike together. So I could do a 10-mile hike with my 82-year-old father, no problem. He's a blue zonian in the making. But we were hiking together in the frosty winter woods of Connecticut, here in New England, a few years ago, and we were climbing up a gradual rise to a ridge, and we were commenting on what a fantastic time we were having. The sun was the limbs of the trees were covered in ice. They were sparkly and shiny and beautiful, and the sun was dappling through. It was just fantastic. And the air was cold, so our breath was frosty, and it was just great. But we were able to do it because we're both vital. He's got a few years on me, but most people my age in our society have multiple chronic diseases, and certainly, we're not hiking 6, 7, 8 miles routinely. But not only can I do it, my father can do it, and we were delighting in it. And we were saying how sad it was. We were reflecting on his patients, my patients over the years, how few of them could do this and how they were missing out. We felt sorry for them, that people were not experiencing the joys of vitality. And so we had an interesting conversation about the fact that, I don't think people understand what health is for. And I started asking my patients, why do you come see me? Well, because I don't want to get sick. I don't want to be sick. I want to be healthy. But that's it. But why do you want to be healthy? Why do you care? And nobody is prepared to answer that question, because it feels like you should be healthy. I said, no, put this away. We don't need this. No, healthy people have more fun. Life is, whatever it is you care about, whatever purpose, whatever connection you want to cultivate, whatever ambition you want to pursue, wherever you want to go, what you want to see, you're much more likely to get there with vitality. It's the foundation, it's the bedrock under everything. healthy people have more fun. I think there's tremendous opportunity for that to become part of the lifestyle medicine narrative, that essentially better connection, opportunity. Yeah, instead of raising your hand about gloomy statistics, get up and dance together. And there's a sense of community. There's a sense of shared aspiration. The idea that we can cultivate our own health and it can redound to the well-being of the planet too. I mean, there's just so much. The value proposition is so incredible. But I'm totally with you. Yeah, I'd like to see fewer hands go up and more people get up out of their seats and start to dance. And dance is just a beautiful visual image of the joy of vitality. And that is a critical part of the lifestyle medicine narrative, the joy of vitality. Don't do this because some doctor says you should. Now, put the admonishing finger away. Do this because healthy people have more fun. Your life will be better if you use lifestyle as medicine.
So let's go into that consultation room when you ask your patients, why do you want your health? What happens?
Saw patients for 30 years. And as you know, I'm doing other things now, addressing public health in other ways. For many years as a researcher, and now running a company and running a nonprofit, the True Health Initiative. But I asked that question of a lot of patients for many, many years. And again, what was arresting about it for me is that people were unprepared for the question and had absolutely no idea how to answer it. Because it's a failing. I think we've sort of shamed people. If you're not thin, shame. If you smoke, shame. And we've done a very bad job of asking people, how did you get into your current circumstance, and what about it makes you happy? What about it makes you unhappy? What looks like a happier way to be for you, and what stands between you and that? But very few people in my experience had connected the dots and understood that the reason being healthy was important is because their lives would be better. You think about exercise and people, oh God, woe is me. I have to put on spandex and sweat and I don't want to do it. It feels like a burden. And it always struck me as almost a little bit ironic that, one way to talk people into exercising was to give them pedometers and have them count their steps. And I thought, well, don't you want to just count your blessings? I mean, picture yourself, if you've got two perfectly good legs, and picture somebody in a wheelchair because of an injury, maybe to their spine, and think, wow, I feel sorry for them. I hope they get better. I'm sorry that if they can't get up and dance ever again, I'm sorry that they've lost that opportunity. There are other ways to have a fulfilled life, I know, but I'm sorry that happened to them. And yet you have two perfectly good legs and you don't use them. You're giving up voluntarily what was taken away from somebody else. So if you can run and jump and dance, how about you count your blessings? It's not a burden to have to be active. It's a privilege to be able to be active. So, there's a whole change in mindset. And, you were talking just a couple minutes ago, Victor, about, sort of the gloom of, the sort of the burden of chronic disease. I don't think it makes people depressed and gloomy. I think it numbs them. I think it's so ordinary to be in your 40s and have either angioplasty or scar from coronary bypass surgery. It's so ordinary to be on medication for hypertension, hyperlipidemia, type 2 diabetes. It's so ordinary. People don't look at that as a burden. They don't look at that as doom and gloom. It's almost like a rite of passage. You hit a certain age and polypharmacy is what we do. You hit a certain age and revascularization is what we do. I mean, the expectation is you'll have heart disease. And so it actually would be a good thing if people looked at that and thought, man, that's awfully gloomy. Yeah, is there a way to avoid it? It's so suffused throughout our culture. It's okay. Don't worry about it. We've got drugs and surgery to take care of that. So keep eating bad food and keep, sitting on your rear end and not exercising, and don't worry about sleeping enough, and let stress eat away at you, and don't cultivate healthy social connections and purpose and healthy spirituality. Don't worry about any of that. Just keep eating really bad food, doing really bad things and getting sick. And then we've got drugs and surgery to take care of you. And it won't be very good for you, but it'll be really good for big food, which will make a lot of money making you fat and sick. It'll be really good for big pharma, which will make a lot of money treating diseases you never needed to get in the first place. And I think it's so pervasive in our culture that people are numb to it. They're oblivious to it. It's just an expectation.
So let me weave this question. So Antoine de Saint-Exupéry, the guy who wrote The Little Prince, said, if you want to build a ship, don't drum up the men to gather wood, divide the work, and give orders. Instead, teach them to yearn for the vast and endless sea. it's clear that in this conversation we are beginning to ask
That's a great quote. That's really great.
we're beginning to ask our health professionals and the doctors to go beyond the ordinary jobs and go, being activists and being teachers and being meditation guides and being a chef and being even a politician. In a sense, I think what we're getting at is that health professionals are probably the dreamers of the new world. Yeah.
So yeah, really interesting. So again, I like that quote a lot, right? I mean, if you get enough people yearning to cross the sea, then human ingenuity kicks in, and you don't have to ask anybody to do anything. You just, everybody starts to work to get where they want to go. I think a lot of that's true about lifestyle medicine as well, but there are important countervailing forces. So, we've got these clinical models, we've got reimbursement models. I mean, certainly here in the US, medicine is sort of a business, and the money kind of calls the shots. And so, the encounters are, we used to talk about 15-minute encounters. Now everybody talks about 9-minute encounters. So the idea that you could do meaningful lifestyle counseling in 9 minutes is absurd. However, I completely agree with you about enlightened lifestyle medicine professionals being in the vanguard of change. So the idea would be, look, we know what better models in medicine look like. So we're yearning for them. That's the great expansive sea. We yearn for them. So we want to build models that will get us there, the ships that will cross that sea. And people in lifestyle medicine are doing that. And some of these innovations are brilliant, and some of them are very simple and obvious. Like, for example, group meetings, telemedicine group meetings, where 10 patients, 20 patients with hypertension, type 2 diabetes, you see them all at the same time. So, instead of seeing everybody for just a few minutes, one at a time, you see everybody together for an hour and a half, and you can talk about everything. The other thing that I think is a huge advance for lifestyle medicine is telemedicine and digitization. That's where my entrepreneurial effort is directed. At Diet ID, my company, we're working to make diet a vital sign, because we can. Everybody can know their diet quality, and that's really important. So everybody should know it, and it's possible now. But it can be done digitally. It takes just a few seconds. Then that becomes information that the health professional can get and react to, and on it goes. So digital innovation, those are ships that can cross that sea we yearn to cross. And new structures for interacting with our patients are ships that can cross that sea. Culinary medicine, basically culinary instruction, that also can be done virtually. And, you can get, I could be watching you show me how to make a great recipe right now, or vice versa. And that's empowering. So there are these new models. And then what we need to do, we want to cultivate passion for these changes. And then we create the yearning in ever more people and ever more entrepreneurs and ever more businesses. And it becomes a shared yearning. And then we start to talk about, okay, there was a certain amount of good we could do as health professionals, lifestyle in medicine. There's a lot more good we could do when lifestyle starts to suffuse our culture. And now we're talking about lifestyle as medicine everywhere people go. So, entrepreneurs in the food space saying, I yearn to cross that sea too. So I want healthy fast food, and, I want plant-based fast food. And, these meat alternatives are an example of that, and on and on it goes. I want a smaller environmental footprint. I want to cultivate years in life and life in years. I want people to be vital and long-lived. I want the blue zone blessings here. I want to be part of that movement. So I think it's our job to inspire. It's our job to be the tip of the spear. It's our job maybe to build the first couple of boats, because we yearn to cross the sea and say, look, it can be done. But then it's not our job, not exclusively our job, to get everybody across that sea. It's too big a job, right? That's where I come back to where we started. Culture is the spoons. Culture, using your quote from Saint-Exupéry, culture is the armada of ships that can get everybody to the far horizon. But we can start the party, we can build the first few ships, but then we want to inspire others. And I think part of doing that is making people truly appreciate the intimate value of lifestyle medicine. This could make your life better. This is a gift that keeps on giving. This is a gift you can pay forward to the people you love. If you get prescribed a medication, if you have revascularization, you have angioplasty, you're not going to share that with somebody you love. Hey, I had angioplasty. Let me pass it along to one of my kids. It doesn't work that way. But if you eat well and are physically active and have a deep sense of purpose and healthy connections to other people, yeah, you can pay that forward. I mean, what a beautiful gift to bequeath to your children, the people you love. So that, there's true inspiration there And there isn't much of that anyplace else in the House of Medicine.
I love how you say that we can initiate and we must initiate a movement beyond the borders of the House of Medicine. We've also discussed about the power of critical thinking, and you've used the metaphor of the elephant and the six blind men, trying to understand something that you can't really get a good grab of everything. And what I want to get to here is, how can we, in terms of actions as a community, that we have understood that our job goes beyond giving the lifestyle medicine prescription and working in building a new culture, what are those levers that we can use in our privileged position? Because as health professionals, we have some sort of privilege, and use that to build this culture that we are talking about.
Yeah, well, so first of all, the poem, the version that I use, it's a famous parable, and it goes back to ancient times. I use the poem by John Godfrey Sachs, The Blind Men and the Elephant. It was six men of Indostan to learning much inclined, who went to see the elephant, though all of them were blind, that each by observation might satisfy his mind, and then each of the six takes hold of a different part and reaches a completely different conclusion. Yeah, so we did that about the pandemic. I think we do that about politics. I think we do that about the climate. Everything that's important. It seems we manage to take hold of a small piece, jump to a conclusion, and ignore the big picture, and that's got to change. So part of my answer, Victor, in terms of what do we do, is we have to break through. I'm tempted to cite yet another story. Horton Hears a Who. So this is a Dr. Seuss story where only the elephant, Horton, with his great big elephant ears. So you brought elephants into the conversation. I'll stick with elephants. So only Horton could hear these tiny little creatures living on a dust speck, and none of the other animals could hear them. So they all thought that Horton was having auditory hallucinations, and they were going to boil the dust speck in a big vat of hazelnut oil. And Horton was trying desperately to save the little friends he knew were there, and they needed to make their presence known to everybody. And ultimately, the heroes on that little dust speck ran around. The mayor of Whoville engaged everybody there to shout it at the exact same moment, "We are here." We need something like that in lifestyle medicine to say, look, there is this growing global coalition, dedicated health professionals who recognize it is possible to have more years in life, more life in years. It is possible to live in a richer, more fulfilled way. It is possible to cultivate health in the service of a better life, not by taking drugs, not by patching things together, no, by never falling off the wall in the first place. All these things are possible. It's possible for you to live a healthy, vital life in a way that you can pass on to your children, that you can share with the people you love. It is possible to live in that world where 8 times in 10, these terrible things that happen all the time don't happen. It's a better world. And it's kinder, gentler to the beautiful places that this planet has gifted us with. All of that is possible. So we are here. That's our "we are here" message, and it's got to be heard. So we have to generate a signal that's audible above the noise. And our problem is a lot like the problem in Horton Hears a Who, where all the animals were chanting, "Boil the dust speck." This who's not only had to be heard, but they had to be heard above noise. We have to be heard above the noise of our culture. Our culture tells people, double bacon cheeseburger, fine. Donuts for breakfast, fine. Coca-Cola and Pepsi every time you're thirsty, fine. You need coronary bypass by the time you're 42, fine. Of course, you're on medication for type 2 diabetes, isn't everybody? Fine. Our culture makes a lot of horrible noise. We have to be audible above that. So we kind of need our "We Are the Who's" movement. Yeah. As you know, I created a nonprofit organization, the True Health Initiative. That's really what it's about. Instead of saying "we are here," what we say at the True Health Initiative is we agree. We agree with this. We agree that we know how to eliminate 80% of chronic disease. We know how to eliminate 80% of premature death. We understand what kind of diet and lifestyle would get us there. And there's massive agreement, even among people you wouldn't think would agree. So, from people who like the paleo diet to people who like the vegan diet, everybody agrees, if they're genuinely expert, that minimally processed foods, whole foods, mostly plants, way to go. As Michael Pollan said, eat food, not too much, mostly plants. That's just fundamentally correct. So we need a "we are here" movement, moment, epiphany. I'm not quite sure. And then what do we do with the attention? So I would say we're still in that phase where we are cultivating the chorus. our challenge is that the volume of noise in the modern world is unprecedented. How do we overcome the echo chambers in cyberspace? How do we overcome the pernicious influence of social media? How do we overcome the tribalism, the diet tribes? I mean, people who declare their allegiance to a particular diet are willing to, I mean, they say horrible things to one another routinely in cyberspace. I try to stay out of the swamps in cyberspace,
Yeah.
but every now and then you find yourself in one. And I mean, just it's look, you happen to like a different kind, you think a different kind of diet is best than the one that I like. That's enough for people to want to kill one another. It's crazy. So I mean, that we've never been so polarized, and the opportunity to generate noisy nonsense has ever been greater. It's a huge challenge. I'd love to be able to say to you, I know the solution. I really don't. I think innovations like the True Health Initiative, which say, look, it's not one person's opinion. It's not what Katz thinks. It's not what you think, Victor. It is global expert consensus. So it's science, sense, and global expert consensus. That's a powerful signal. But it needs to be more powerful, and we need it in more areas. And then we need to figure out good ways to make sure that we can broadcast that signal so that it gets amplified. Is that working more with the media to help us amplify the message? Changing culture is not an easy thing to do, right? I mean, we're trying to turn the Titanic around with the iceberg coming in fast. It's a big job. We shouldn't expect it to be easy. So this is one idea about, something we can do that's new and innovative and maybe helpful, but we need many more such ideas. And ultimately, we have to manage to generate signals audible above the noise. We know what we could accomplish if only people would heed. Getting them to heed is no trivial task.
I'm glad how you put it that way, because the expectation is usually that it's very stressful and we need to find a solution, so we run and we rush to get a solution. But this is no small task, and it won't take a few years. It will take decades, and it's wiser to put it that way, because then solutions won't dissolve into easy fixes. And
and I agree with you. And actually, let me quickly append something. So I think we're obligated, and you're more expert in critical thinking than I am, and I love the fact that you're actively studying that. I mean, that fascinates me. I dabbled in it. I took logic as in college, and I certainly, I'm an amateur in critical thinking anyway.
I'm not sure about that, because critical thinking is just thinking from several perspectives. It doesn't mean more than that.
Maybe I have some native inclinations that way. But I think if we're struggling with the challenge of making lifestyle the universal medicine you and I know it ought to be, and we want, I mean, that's our yearning to cross this great luminous sea. We're obligated to ask, well, why isn't it the default? Why didn't we just happen to develop a culture where we were eating optimally, physically active, got enough sleep, weren't stressed out, et cetera, et cetera? How did we go wrong in the first place? Why is it hard? Why can't it just be easy? And I think there are good reasons. And one of the things I routinely point out is that throughout most of human history, let's just focus on diet for a minute. We could talk about each of the pillars of lifestyle medicine in the same way, but diet's where I spend most of my time and effort. So we talk about diet and nutrition. Throughout most of human history, calories were relatively scarce and hard to get. And physical activity was unavoidable. It did not require gym membership or specialized footwear. It was called survival, and everybody just did it every day. We have devised a modern world where physical activity is relatively scarce and hard to get, and you do have to join a gym and get specialized footwear, and calories are unavoidable. So, okay, let's just think about that for a minute. So all of our native adaptations are designed to protect us in a world where it's hard to get enough to eat, it's hard to get enough sugar, it's hard to get enough fat, it's hard to get enough salt, it's hard to get enough protein, it's hard to get enough variety, and designed for a world where physical activity is unavoidable. So actually, if you can figure out a way to do less physical work, it's a good thing. Well, we're a really ingenious species. So confronted with the challenge of not enough food and too much physical exertion, we put our great big Homo sapien brains to work and started to devise more and more solutions. Well, the problem we didn't anticipate was that we would overshoot. So, we went from a world where there wasn't enough sugar, salt, fat variety to a world where you can live in an all-you-can-eat buffet all the time. Oops. And there was too much demand on our muscles just to survive every day. So we designed so much labor-saving technology that pretty much all we need to do now is move our thumbs. Oops. So this is the first time in the annals of biology when a species is obligated to deal with the liabilities
Yeah.
of its own success. That doesn't tend to happen. Welcome to 2021, and we will be the first animal that figures out, how do you check yourself? How do you stop your ingenuity? How do you turn around the solutions that you built that are too good? I mean, in a sense, we solved the problem of food shortages by creating a constant surplus. We created the problem of food not being tasty enough by making it hyper palatable. So, yes, I think there is some nefarious practice in this. You mentioned Michael Moss. We know the food supply is willfully manipulated by scientists working for big food to be addictive. But all of that effort began simply by applying human ingenuity to solving problems. It's hard to get enough salt. Animal salt lick. It's not easy to find salt on land. It's all in the ocean. If you live on land, enough salt is hard to find. We fixed it. We fixed it too well. Now we have sodium excess.
Yeah.
It's hard to find a lot of sugar. It's in honey, and you have to fight the bees to get to the honey, and in wild fruit.
Yeah.
We fixed it. We extracted it from sugar cane and corn, and so now it's everywhere. On and on it goes. So it makes sense that getting to lifestyle as medicine is hard, because we literally are trying to turn around the inertia of 15,000 years of human ingenuity and civilization. We really are. We've always been solving the problem of too little food, too not tasty enough, not salty enough, not sweet enough. These are all brand new problems. And we've always been trying to solve the problem of human muscles have to do too much. We've never before had to solve the problem of them needing to do too little. So I start conversations about why can't we just snap our fingers and have lifestyle be medicine? We are up against 6 million years of evolutionary biology and 15,000 years of human civilization. That's what we're trying to turn around. That is no small feat.
Yeah, and I guess that in an hour-long podcast recording, we won't be able
We
to.
won't fix it all, but at least we can get our arms around the problem. That's a start.
Yeah. One thing before wrapping this up, the opportunity of a crisis. Like we've seen in humanity that when a crisis emerges, then it's a good time for a revolution, for a change in big structures, both ideological and systemic, political, economical. What's your
It's funny. I'm reading Thomas Kuhn right now, The Structure of Scientific Revolutions. That sounded like language directly from the book.
It might be. I just taught a class on Thomas Kuhn a few weeks ago.
Really?
So probably I have that language. So yeah, what is this moment of crisis that we're living, and how well do you think we will be able to learn from it, or just rushing to get back to normality as if nothing happened?
You're talking about the pandemic, but it's more than the pandemic, Victor. I mean, we're at such a critical tipping point in terms of the climate, and again, it's no longer an abstraction, right? People are living climate change every day. No matter where you are in the world, you're feeling it. We're feeling resource shortages. The pandemic, which disrupted supply chains, I think accentuated our awareness of that. It accentuated our awareness of interconnection. What a small world it is, right? We were all living the same pandemic experience. It didn't matter what part of the world you were in. We were all having the same fears and anxieties. And so I think this is a crisis that represents a dangerous opportunity. I think awareness has shifted. I think the importance of addressing the planet as a patient in critical care, I think that's now widely recognized. I think more health professionals are recognizing the confluence. I'm hopeful. Again, it's certainly never too late to do something, but the sooner the better. And the consequences of delaying action are grave. For an individual, where you can decide you're going to suddenly fall in love with lifestyle medicine after you've had a stroke. It's much better to do it before. You can do it after your big heart attack. It's much better to do it before. Similarly, for all these big issues, public health, global health, pandemic management, international cooperation, managing, carbon emissions. I mean, all of that, the longer we delay, the graver the consequences. So I can't say that talking about this is anxiety free. I'm worried. But I'm hopeful as well. And I have to say, a conversation like this beautiful discussion with you, it amplifies that hope. Just to hear from other people who are thinking deep thoughts about this and probing for solutions and looking for ways to share them and engage more people. It's very encouraging. So I think there is a confluence of need and a confluence of awareness now. And yes, we have great challenges, but there really is a luminous opportunity in the current crisis too. So I am hopeful.
Thank you so much, Dr. Katz. Is there any other quote, poem, story that you would like to share? Because at the end of the day, that's what we're talking about today.
Well, there are many that I cite routinely. Two roads diverge in the yellow wood, and sorry I could not be one traveler and follow both. We could talk about, the road less traveled. We could talk about John Donne, No One is an Island. There are many that I routinely weave into my discussions. But I think, frankly, the story that we're sharing is that we both feel a yearning to cross that luminous sea, and we see an opportunity for everyone else to do it. And again, it's not about moralizing, it's not about shoulds. It really is about enhancements to the human condition. And we just need to make more people aware of that opportunity. It is within reach. Human ingenuity is capable of wonder. So I think, people listening to this conversation should recognize, yeah, there are challenges. We're fully capable of doing this. We got to the moon, we got to Mars, we can get to Venus. We can cross this sea of human opportunity to a place where there are more years in life. There's more life in years, where we live in a harmonious balance with one another in the planet. It may sound utopia, but it's not. It's achievable. We just have to share the yearning. So I don't know the perfect quote about shared yearning, but I'm happy to forego quotes and just tell you, Victor, that this conversation represents that yearning. I think beautifully articulated. It's been a pleasure speaking with you.
Thank you, my friend. I really I enjoyed this conversation, and I'm sure that many people will be inspired to delve deeper into the world of ideas as the big levers of transformation.
I hope so. And a part two anytime, my friend. Just let me know what works for you.
All right, I'll send some ideas then. Thank you so
Very
much,
good.
my friend. You have a great day.
Same to you. Take good care.